Good morning, friends. Welcome to our next learning session. And today I am going to talk of hyperventilation. Friends, what is hyperventilation? You have seen many people breathing rapidly. This rapid or increased rate of breathing than normal is called hyperventilation. What is its effect on the body? When you breathe rapidly, you are breathing out carbon dioxide, and your carbon dioxide in your blood level will become less, and that can cause a lot of problems like tingling in your lips, and you will feel short of breath at these things. Now, about 40 years back, a young boy who had a problem in the family with the parents, he cut his wrist and was admitted in a government hospital. In the hospital, he developed hyperventilation, and this led to the tetanic spasms, which caused further worry to the parents. The doctors knew that it is because of low ionic calcium in the blood. Therefore, they injected calcium gluconate intravenously. The movements stopped for a short while, but again started because the hyperventilation was going on. Now, with hyperventilation, you lose carbon dioxide, resulting in low carbon dioxide in the blood, which results in acidosis, and that lowers the level of ionic calcium, and this results in tetanic spasms. So, when calcium gluconate was injected intravenously, that calcium level was restored to normal, ionic calcium I am talking about, and the spasm start. But because the hyperventilation was going on, so within seconds this level again became less, and the second shot of calcium gluconate was given, again lasting for a few seconds. Then the doctors gave sodium bicarbonate intravenously, and his spasm stopped altogether, because this sodium bicarbonate neutralized the acid being produced in the body, and the ionic calcium was restored to normal. About 20 years back, a very senior ENT specialist referred a case of young girl who was about 20 years of age with breathing difficulty. I examined the girl. Her pulse was slightly fast. She was breathing rapidly. There was nothing wrong with the physical examination. The respiratory sounds were vesicular. They were normal. The vocal resonance and vocal frequencies were normal, and there was no abnormal breathing like bronchial breathing. There were no extra sounds like rals, like pleural rub, or decreased breathing, or any other abnormal thing in the examination, in the physical examination of the lungs. So I asked them to give her some oxygen, and I was actually requested to admit the patient. I did it because it was being referred by a very senior ENT specialist, and I later came to know that the girl was a distant relation of the doctor himself. So the next morning, when I was going to see the girl again, on my way back to the nursing home, I received a telephone from the nursing home that the girl has again gone into a fit of this. They were all calling it dyspnea, but actually it was hyperventilation. I told them to start oxygen inhalation. They did that. Meanwhile, in 10 minutes I reached the hospital, and I had made up my mind now. So I told them to remove the oxygen mask, stop the oxygen inhalation, and bring a polythene bag. Now this type of polythene bag which I am showing you, this is a polythene bag. You see, this is I asked for this type of bag, and what I did was, first I show you this diagram. See this diagram. Here in this diagram, this girl is using this polythene bag. Here she is holding the bag on your mouth and neck, mouth and nose. You see, this is covering. It is tightly covering nose and mouth so that remains inside the plastic bag. And then she is holding it firmly so that no gap is left. She will breathe from the bag and she will breathe back into the bag 5-6 times. I will now show you the live demonstration, what I told the girl to do and how it is to be done. See, this is to come on the nose as well as mouth, like this, and then it to be held firmly. No gap is left. See, between neck and bag, it is firmly here. Now I have to breathe from the bag, then breathe back into the bag. Now see, you are breathing in, breathing out. Now I am going to breathe in. I am going to breathe out. So what you see? You see, when I breathe out, the bag inflates, and when I breathe in, the bag collapses. See again, again see this. I am going to breathe in, breathe out. So when I do this 6-7 times, the carbon dioxide which was coming out in my breathing, I am taking it back into my lungs, maintaining the level of carbon dioxide and at the normal level, and therefore preventing the acidosis. And once the acidosis is prevented, the calcium, ionic calcium level remains normal, and when that remains normal, the hyperventilation also stops, and any extra convulsions or tetanic swords, they also are taken care of. So this is a very important maneuver, bedside maneuver, harmless maneuver, at the same time very rewarding maneuver. So friends, thank you very much. Next time I will show you another case, an interesting case, and I have been actually very busy in bringing out my book on medicine. Very shortly I will probably display it on the Facebook, and maybe I intimate you where it is available, because some publisher is doing this job. I am providing him the material. I am the author of the book, but publisher is somebody else, and I am dependent on them. Thank you very much. Meet you next time.